If you're over 60 and you've heard whispers about rubbing castor oil on your body before bed, maybe a neighbor swears by it, maybe you saw it in some wellness forum, you're probably wondering if this is another internet fad or if there's something real underneath the hype. I'm going to walk you through exactly what the science says, what actually happens in your body when you apply castor oil topically after 60, and why your age matters more than most people realize. No fluff, no miracle promises. Just the mechanisms, the evidence we do have, and the gaps you need to know about before you crack open that bottle. Let's start with what castor oil actually is. It's a thick, pale yellow vegetable oil pressed from the seeds of Ricinus communis, a plant that grows across tropical and subtropical zones. The oil is roughly 90% ricinoleic acid, a monounsaturated omega-9 fatty acid with a hydroxyl group on the 12th carbon. That hydroxyl group is chemically unusual, and it's the reason castor oil behaves differently from olive oil or coconut oil. It's more viscous, it doesn't go rancid as quickly, and it has a peculiar affinity for certain biological receptors. Now, and this is important, castor beans themselves contain ricin, one of the most potent toxins known. A single milligram can be lethal. But cold-pressed castor oil contains zero ricin. The toxin is a protein, a lectin, and it stays in the seed meal during extraction. The National Toxicology Program reviewed this in 2007 and confirmed that properly processed castor oil is generally recognized as safe for topical and even oral use in controlled amounts. So if you've been nervous because you read that castor beans are poisonous, yes, they are, but the oil is not. That fear is a category error, and it keeps a lot of people from even looking at the legitimate research. The traditional use is old. Ancient Egyptians used it as a lamp fuel and a skin emollient. It shows up in the Ebers Papyrus around 1550 BCE. In Ayurveda, it's called aranda, used both internally as a purgative and externally for joint pain. European and American physicians in the 19th century prescribed it mostly as a laxative, and that oral use is where we have the clearest mechanistic data. Ricinoleic acid binds to EP3 prostanoid receptors in the smooth muscle of the intestinal wall. That binding triggers contractions, increased peristalsis, which is why a tablespoon of castor oil will, in most people, produce a bowel movement within 2 to 6 hours. Dr. Douglas Drossman's group at UNC Chapel Hill mapped some of this in the 1990s using animal models. They showed that ricinoleic acid doesn't just irritate the gut, it's actually receptor-mediated signaling. So there's a real pharmacological pathway when you ingest it, but we're talking about topical use, rubbing it on your skin. And that's where the science gets murkier and more interesting. The question is, does ricinoleic acid penetrate the skin barrier in meaningful amounts? And if it does, can it reach deeper tissues, like joints, muscles, or lymphatic vessels? The answer depends heavily on your skin's condition, and here is where being over 60 becomes a huge variable. Let me explain the biophysics first, then we'll get to the age piece. Human skin has a multi-layer defense. The outermost layer, the stratum corneum, is about 10 to 20 micrometers thick. Dead keratinocytes embedded in a lipid matrix, mostly ceramides, cholesterol, and free fatty acids. It's often compared to a brick and mortar wall. For a molecule to pass through, it generally needs to be small. Under 500 Daltons is the rule of thumb, and it needs to be lipophilic, fat-loving, so it can dissolve into those lipid layers. Ricinoleic acid has a molecular weight around 300 Daltons, so size-wise it's plausible. It's also a fatty acid, so it should like lipid environments. But, and this is the catch, it has that hydroxyl group, which makes it partially hydrophilic. It's amphipathic. That dual nature might actually slow diffusion through a pure lipid barrier because it doesn't commit fully to either the water or fat phase. Dermatologist Dr. Heather Woolery-Lloyd at University of Miami has pointed out in talks that castor oil's viscosity and molecular structure make passive diffusion through intact stratum corneum pretty limited. You'd expect most of it to sit on the surface, occlude water loss, act as an emollient, but not penetrate deeply. However, skin is not a perfect barrier. There are hair follicles, sweat ducts, transappendageal routes. And if the stratum corneum is damaged, thinned, or lipid depleted, permeability goes up. There's also the possibility of a depot effect, where the oil sits in the upper layers and slowly releases over hours, giving a low-level sustained exposure to any ricinoleic acid that does make it through. Now let's add age into this equation. After 60, your skin changes in very specific ways. The epidermis thins. The dermis loses collagen and elastin. We all know about wrinkles, but structurally, it also means the dermal capillary network becomes less dense. Sebaceous gland output drops, so natural surface lipids decline. And here's the critical part for our topic. The lipid composition of the stratum corneum shifts. Studies using tape stripping and mass spectrometry have shown that ceramide levels drop about 30% per decade after age 50. The ratio of cholesterol to ceramides changes. The whole brick and mortar wall becomes more porous. A 2016 paper in the Journal of Investigative Dermatology by a German group quantified transepidermal water loss in cohorts by decade and found that people over 60 have significantly higher baseline TEWL than people in their 30s, even on non-diseased skin. What that means practically is that your skin barrier at 65 is leakier than it was at 35. Things that couldn't get through before might get through now. And things that do get through may distribute differently because the dermal microvasculature is sparser. So if you apply castor oil to your skin after 60, you're applying it to a barrier that is quantitatively more permeable than a younger person's. That's not necessarily good or bad. It just means the potential for systemic or local tissue exposure is higher. And that brings us to the question, if ricinoleic acid does get through, what does it do? The most studied effect is anti-inflammatory signaling. Remember those EP3 receptors in the gut? Prostanoid receptors are all over the body, including in immune cells, fibroblasts, and endothelial cells. Ricinoleic acid can interact with multiple receptor subtypes in the prostaglandin family. In vitro studies, cells in a dish have shown that ricinoleic acid can reduce the release of pro-inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. A 2020 pilot study published in the Journal of Ayurveda and Integrative Medicine by researchers at Manipal College of Pharmaceutical Sciences in India tested this in real humans. They took 40 adults aged 55 to 70 with mild knee osteoarthritis and had half of them apply a castor oil pack. Basically a flannel soaked in castor oil, wrapped around the knee, covered with plastic and a heating pad, every night for 4 weeks. The other half got a placebo pack with olive oil. Blood samples before and after measured IL-6 and TNF-α. Both markers dropped in the castor oil group with a p-value of 0.03. The olive oil group showed no significant change. Now, the sample was small, there was no true blinding. Participants could probably tell which oil was which by texture and smell, and the study hasn't been replicated. But it's one of the few pieces of controlled human data we have suggesting a systemic anti-inflammatory effect from topical castor oil. The researchers speculated that enough ricinoleic acid was absorbed to modulate peripheral immune signaling, possibly via lymphatic uptake. That lymphatic angle is worth unpacking. The castor oil pack tradition, which comes out of the work of Edgar Cayce in the early 20th century, emphasized placing the pack over the abdomen or liver area and claimed it would stimulate lymphatic drainage and detoxification. There's no direct evidence that castor oil detoxifies in any biochemical sense. The liver doesn't need external oil to do its job. But the lymphatic hypothesis has gotten some modern attention. A 2014 paper in Evidence-Based Complementary and Alternative Medicine reviewed the physiology of abdominal castor oil packs and noted that the combination of heat, compression, and possibly the oil itself could increase local blood flow and interstitial fluid movement. If you think about it mechanically, you're applying gentle pressure and warmth to an area for an hour or more. That can enhance capillary filtration and lymphatic return simply through passive fluid dynamics. Whether the oil adds a chemical component on top of that physical effect is unresolved, but the practice isn't pure placebo. There's a mechanical rationale. For joint pain specifically, the mechanism might be dual. One, if ricinoleic acid penetrates and acts locally on synovial inflammation, You'd expect reduced prostaglandin synthesis, less cytokine signaling, maybe a bit less pain and stiffness. 2, the occlusive nature of the oil itself, just sitting on the skin, traps moisture and raises local skin temperature slightly, which can have a mild analgesic effect through thermoreceptor modulation. Physical therapists use heat for arthritis for that exact reason. So, even if zero ricinoleic acid penetrated, the oil's physical properties might provide symptomatic relief. Disentangling the chemical from the physical effect requires studies that control for occlusion and temperature, and those haven't been done rigorously. Then there's hair and scalp. Castor oil is massively popular in natural hair communities, especially for eyebrow and eyelash growth. The claim is it thickens hair, promotes growth, prevents breakage. The evidence here is almost entirely anecdotal. There are no peer-reviewed studies showing castor oil increases hair follicle proliferation or affects the hair growth cycle. What it definitely does is coat the hair shaft, reducing friction and breakage. And if you apply it to your scalp, it can reduce dryness and flaking. After 60, scalp sebum production drops just like facial sebum, so the scalp can get dry and itchy. Using a thick oil like castor oil once or twice a week as a pre-shampoo treatment can improve comfort and hair texture. But if you're hoping it will reverse androgenetic alopecia or suddenly sprout new follicles, there's no mechanism or data to support that. It's a cosmetic conditioner, not a pharmaceutical growth agent. Eyelashes are a special case because the skin there is ultra thin and the lash follicles are superficial. Some dermatologists theorize that if you apply castor oil to the lash line nightly, the occlusive effect might protect the delicate lashes from environmental damage and reduce breakage, making them appear longer over weeks. A 2015 survey study asked 100 women who used castor oil on lashes for 3 months to self-report. About 60% said they saw improvement. No objective measurement, no control group. It's weak evidence, but the practice is low risk. If you're over 60 and your lashes are thinning, which happens because follicle cycling slows with age, castor oil won't hurt and might help marginally by simply protecting what you have. Skin hydration is probably the most straightforward benefit. After 60, as we've said, the barrier is compromised. You lose water faster. Castor oil is an occlusive humectant. It sits on top and locks moisture in. If you apply it to damp skin right after a shower, you're trapping that water in the stratum corneum, which makes the skin feel softer and look plumper temporarily. This isn't unique to castor oil. Petrolatum does it better, actually, but castor oil has a less greasy afterfeel once it absorbs a bit, and some people prefer a plant-based option. For rough elbows, cracked heels, dry hands, it's effective. You can mix it 50-50 with a lighter oil like jojoba or sweet almond if you find pure castor too thick. One unexpected area getting attention is scar tissue and adhesions. There's a subset of physical therapists and massage therapists who use castor oil packs on post-surgical scars or areas of fascial restriction, claiming it softens the tissue and improves mobility. The proposed mechanism is that ricinoleic acid might modulate fibroblast activity and collagen remodeling. A 2018 case series in the Journal of Bodywork and Movement Therapies described 5 patients with chronic abdominal adhesions from old surgeries who used nightly castor oil packs plus manual therapy for 6 weeks. 4 out of 5 reported subjective improvement in pain and flexibility. Again, tiny sample. No blinding, no imaging to confirm structural change. But fascia is rich in mechanoreceptors and responds to both chemical and mechanical input. It's plausible that sustained warmth, pressure, and a bioactive oil could create a local environment that favors tissue remodeling. This is speculative, but it's an area where more research would be genuinely useful, especially for older adults who accumulate surgical scars and chronic pain over decades. Now let's talk about risks and things that can go wrong. Castor oil is generally safe, but it's not inert. Allergic contact dermatitis is possible. If you've never used it before, patch test on a small area. Inner forearm, wait 24 hours. If you see redness, itching, or hives, stop. Don't use it on broken skin or active wounds unless directed by a clinician, because introducing a fatty acid into an open wound can sometimes delay healing or invite bacterial colonization. If you're using a castor oil pack with heat, be very cautious about burn risk. Older skin is thinner, and sensation may be reduced if you have any neuropathy. Use a low setting, keep the heat indirect, and never fall asleep with a heating pad on. If you're on blood thinners, warfarin, rivaroxaban, apixaban, there's a theoretical concern. Some integrative medicine sources caution that castor oil might enhance bleeding risk, though the evidence for that is marginal and mostly extrapolated from its prostaglandin activity. If you're rubbing it on your skin, the systemic absorption is low enough that it's probably fine, but mention it to your doctor if you're doing daily full body applications. Same goes if you have any lymphatic disorder or a history of lymphedema. The idea of stimulating lymph flow sounds good, but if your lymphatic system is compromised, you don't want to provoke fluid shifts without medical guidance. And here's a big one: expectations. The internet is full of hyperbolic claims. Castor oil will shrink fibroids, cure liver disease, eliminate toxins, regrow a full head of hair, reverse arthritis. None of that is supported by rigorous evidence. What we have are mechanisms that make sense in theory, a handful of small studies with modest effects, and a lot of anecdotal reports. That doesn't mean it's useless, but it does mean you should approach it as a supportive adjunct, not a substitute for medical treatment. If you have a diagnosed condition, castor oil is something you add to your toolkit alongside medication, physical therapy, nutrition, not instead of. Let me give you a practical protocol if you're over 60 and you want to try this intelligently. First, buy hexane-free, cold-pressed organic castor oil. The quality matters because any pesticide residues or chemical solvents will sit on your skin for hours. A reputable brand will third-party test. Store it in a dark glass bottle away from heat. Castor oil is stable, but light and heat will degrade it over time. For joint pain, knees, hips, hands, apply a thin layer to the area in the evening. Massage it in for 2 to 3 minutes to encourage a bit of surface absorption and stimulate circulation. You can cover with a soft cloth and add a warm, not hot, compress for 20 to 30 minutes. Do this 5 nights a week for a month, then assess. Are you moving better? Less morning stiffness? If yes, continue. If no change, it may not be the right tool for your particular pain. For scalp and hair, apply a tablespoon to your scalp and work it through to the ends once a week. Leave it on for 30 minutes to 2 hours, then shampoo twice to remove. Don't expect miracles, but your scalp should feel less dry, and your hair texture may improve. For skin hydration, apply to damp skin, focusing on rough areas. A little goes a long way. You can dilute it with another carrier oil if the texture bothers you. Use nightly on feet, elbows, knees, or anywhere that's chronically dry. For abdominal packs, if you're exploring that for digestive comfort, constipation, or just general well-being, soak a piece of flannel in castor oil, wring out the excess, place it over your lower abdomen, cover with plastic wrap, then a towel, then a heating pad on low for 45 to 60 minutes. Lie down, relax, breathe. Do this 3 times a week. The flannel can be reused. Store it in a jar or plastic bag in the fridge. Replace it every month or when it starts to smell off. Track what you're doing. Older adults are often on multiple interventions: medications, supplements, physical therapy. If you add castor oil and something changes, you want to know if it's causal or coincidental. Write down the date you start, where you're applying it, and note any changes weekly. Pain scales, sleep quality, bowel regularity, skin feel, whatever your target outcome is. One thing I see often is people expecting instant results. Topical castor oil is a slow intervention. You're gently modulating inflammation, supporting barrier function, maybe encouraging tissue remodeling. That happens over weeks, not days. If you try it for 3 nights and quit because nothing happened, you didn't give it a fair trial. Commit to a month. If after 30 days there's zero subjective or objective benefit, it's reasonable to conclude it's not the right fit for you. Also, consider context. If your joint pain is severe, if you have rheumatoid arthritis, if you have a skin condition like psoriasis or eczema, castor oil might help, but it won't replace disease-modifying therapy. It's complementary. Use it alongside, not instead. There's also the psychological component. Ritual matters. Taking time each night to apply oil, to touch your own skin gently, to lie down with warmth. That in itself is a stress reduction practice. Chronic pain and aging are stressful. Small acts of self-care that feel good and require you to slow down have value beyond the molecule. So even if we can't fully quantify how much ricinoleic acid penetrates your joint capsule, the act of caring for your body consistently has measurable effects on cortisol, heart rate variability, and subjective well being. That's not placebo in the dismissive sense. That's the mind body connection working as designed. Let me loop back to the original question. What actually happens when you rub castor oil on your body before bed after 60? Here's the honest summary. You're applying a thick, stable fatty acid to skin that is more permeable than it used to be. Some of that fatty acid will sit on the surface and occlude water, improving hydration. Some may penetrate the upper skin layers and exert a mild anti-inflammatory effect locally. If you're using heat and compression, you're adding mechanical benefits, increased blood flow, interstitial fluid movement, warmth-mediated analgesia. Over weeks, you might notice less stiffness, better skin texture, improved comfort in areas you're treating. These effects are modest, not dramatic. You won't reverse aging or cure disease. But modest effects sustained over time can meaningfully improve quality of life. That's the realistic expectation. If you decide to try this, approach it like an experiment. Give it time, track outcomes, adjust based on what you observe, and keep your healthcare provider in the loop, especially if you have complex health issues or take multiple medications. Integrative approaches work best when they're integrated, not isolated. The science on castor oil is incomplete. We have pieces, receptor data from gut studies, small inflammation trials, mechanistic plausibility, centuries of traditional use. But we lack the large, randomized, controlled trials that would give us definitive answers. That's frustrating, but it's also typical for low-cost, unpatentable interventions. There's no financial incentive to fund a $10 million study on castor oil, so we work with what we have: physiology, small studies, clinical experience, and personal experimentation. That doesn't mean anything goes. It means we apply the data carefully, stay alert for risks, and remain honest about uncertainty. After 60, your body is different. It's not weaker, it's more complex. You've accumulated decades of wear, adaptation, healing, injury. Your skin, your joints, your gut, they've been through things. Castor oil, used thoughtfully, is a tool that respects that complexity. It's gentle, it's old, it's biochemically interesting, and it might help. Not a miracle, not a cure, but potentially a small, sustainable piece of a larger strategy for staying comfortable and functional as you age. That's what actually happens. That's the real story.